This is the Pro-Lordotic, and as its name suggests, its job is to improve the lordosis, or the normal curve in your neck. There's two ways that we can use this, and your chiropractor would have suggested which one to use. I'll demonstrate both so you can follow one at home. So the first one is simply placing it behind your neck. You want to aim for the small of your neck, so the hollow part, probably closer to the bottom, about where your collar sits. And then you're slightly bringing your hands forward to provide resistance as you look up to the ceiling. And that's just repeated. I suggest do 10 in a row, just like this. Now the second exercise, a little bit more technical, but you may have been prescribed this if you have quite a prominent sort of forward head position like this, and your chiropractor, with your help, is trying to improve not just the position of your neck, but also to improve that curve in the neck too. So this one has a two-part movement, sits in the same spot, but as you push forward, you look up and then pull back at the same time and then relax. So looking up, pulling back, looking up, pulling back. Now, it's key that you get a lot of repetitions in of this at home or at work. Now, I've found the best way to get enough is doing 10 every hour. The research suggests you need to do 100 of these a day to be effective. And the way it works best is if you split that up regularly. So what that stops is any build-up of that poor posture, and every hour you're resetting your posture back to that ideal position.